Right, so thank you very much to everyone for attending. Jon's going to give us an overview of all of the problems and opportunities that are going on within the NHS at the moment. There's a small army of campaigners across the country, and I know there's 3 possible meetings on the NHS I could have been at tonight as well as this one. So we're not short of people who want to do something. And I've said for months, if you're feeling fed up politically, go and do a stall on the NHS and you'll see what the attitude of people is. And that's not just Liverpool, because, you know, I live in Cheshire, just outside the Merseyside boundary. But we've been campaigning down into Crewe and south of Crewe, where it's definitely not the same politics as Liverpool, and you do get the same response on the issues of the NHS. Sometimes people are a bit defeated, but they agree with what you're trying to do. So please, you know, we want to hear from everybody. We want to hear from people, those who are miserable about it, those who think things are great, those who people just want to discuss how we should prioritise things in the NHS. So, Jon, how long do you want me to give you?
Well, I'll sort of aim for no more than 20 minutes, if that's okay.
That's fine.
Is that all right?
Yeah. We want to hear what you've got to say, and we want to have time to discuss it.
Yeah.
So, does anybody else want to raise anything immediately before we go on to the meat of the meeting? No? Okay, so thank you very much. Jon Puntis, long-time member of Keep Our NHS Public, really one of the leading thinkers of Keep Our NHS Public, and one of the people who's kept the campaign going since the organisation was started. So, Jon, please tell us what's going on in the NHS before we have our discussion. Thank you.
Yeah, thanks, Felicity. So some of this is no doubt going to be a bit depressing, but on the other hand, I think there are positives, as Felicity mentioned, and there are things that we can do. And I need to finish up by telling you about the new campaign, SOS NHS, that's being launched. So, you know, we're almost 2 years into the pandemic, and you know, it's been a long time. And early on, we were told the first lockdown would send coronavirus packing. Then we had this world-beating test and trace system, which was going to send coronavirus packing. Then actually something really useful did come along, which was the vaccine, which again was going to send coronavirus packing. But of course, a vaccine by itself is only part of a strategy. And one of the problems has been that the government has focused very much on vaccine or some new medical intervention that would get us out of the problem, and has generally neglected public health measures aimed at reducing viral transmission, and that continues to be an issue. Things actually were feeling more positive until the beginning of November, and then of course we got a new variant, Omicron, which people have been warning would happen, of course. One of the consequences of not getting infection levels low, and particularly one of the consequences of not making vaccines available to the rest of the world. But at the same time as we saw the new variant, you had the Secretary of State for Health saying that we needed to learn how to live alongside the virus. And then despite the fact that groups like Independent Sage were saying we have to introduce more restrictions now to prevent a huge surge in cases, this was brushed aside. And you had the Prime Minister saying, celebrate New Year's Eve, but exercise caution. And that's one of those sort of classic mixed, ambiguous public health messages, which has bedeviled the government's response all along. You know, what does it mean? It means you can go out and enjoy yourself in large crowds on New Year's Eve, but exercise caution. the last week, or maybe even this week, I think it was earlier this week, we had the Education Secretary, of all people, who's an ex-oil industry executive, saying that we needed to lead from pandemic management to an endemic situation. In other words, saying, the whole problem is more or less over, and we can live with the virus, which is absolutely wrong at the moment. And of course, the numbers of cases absolutely skyrocket. So I think that on the 1st of January, there were 210,000 new cases in one day. And because people were being told do lots of lateral flow tests, the supply in the face of that advice and increased demand ran out. The company that handles the lateral flow devices did receive 2.4 million devices, I think, just before Christmas, but then shut up shop for 4 days, so this weren't circulated. And lateral flow devices, they're not being used in the way that they're intended. There are problems with them. They miss a lot of infections. If you have a positive lateral flow test, then you've almost certainly got COVID, but if it's negative, you might be missing it. So they shouldn't really be used in the way that they are, saying if you've got a negative test, it's fine to go out and about. But that's another discussion, perhaps. And then we've also heard that the NHS is on a war footing. Well, if it is on a war footing, one of the things we should do is start requisitioning the private sector, I think, bringing into the national effort under this banner of war footing, not giving it more money, which is what's actually happening in practice. Chris Whitty has been a little bit more outspoken as the months have gone by, and he did say to the government and the rest of us when Omicron came along, there's lots of things we don't know about it, but what we do know about it, everything we do know about it is really bad. One of them being that it spreads very, very quickly. But nothing, there's really no response from this. And government said, no, it's okay, we can carry on. And I like the comment by Roy Lilly, one of the health service commentators that some of you will be familiar with. And he said that for ministers to say there's nothing in the data to indicate further measures are needed to control spread, is that it's feckless, stupid, criminal, and mendacious blindness, which I thought was a phrase that summed it up quite appropriately. Some people are saying the government's got away with it. I mean, Jeremy Hunt congratulated, perhaps not surprisingly, but congratulated Johnson, I heard in Parliament the other day, and I was listening to the late night programme, saying that he was right, that we haven't seen the NHS overwhelmed. But I don't think that's true. We haven't seen as many deaths as some thought we might do. But we're still seeing considerable number of deaths. I mean, when I worked it out a week ago, it was 1 death every 13 minutes from COVID. And we've now seen an increase in hospital admissions up from 6,000 to 10,000 and then to 18,000. It's a very steep upward trend. Of course, a lot of those people, most of them are not on intensive care, but there has been an increase in intensive care patients as well. And the question is, even if we haven't seen ITUs overwhelmed, what impact is this having? Well, it's having a dreadful impact on staff. At Christmas, there were 68,000 staff on sick leave, not all of them with COVID or needing to isolate, others with stress, but 68,000 staff off. And this, of course, has affected all branches of society. So in London, you had 15% of the fire service who were isolating or off sick, 40% of appliances out of action. Schools now facing huge problems because of teacher absences. Many parts of the country where the overflowing bins from Christmas haven't been emptied because of refuse collectors being off sick. And you've now had many critical incidents declared by hospital trusts where they basically are saying in a very clear manner, we haven't got enough staff to look after patients safely. And then in Manchester, just one example, but 17 hospitals in Manchester that stopped doing elective surgery. So what this means is, even if ICUs haven't been overwhelmed, huge stress on staff, huge problems in many other frontline services, and an increasing backlog adding to the over 5 million people on waiting lists for NHS care, and people finding that their routine NHS care, including when they have acute problems, is not being dealt with. And this translates not only into suffering, but into excess deaths. The ambulance service is so stretched that people have been asked not to call an ambulance, but to get friends and family to drive them into hospital. So there will be a huge impact from this, whatever people say. It's no good presenting it as, oh, the NHS is managing, or as the way Johnson did, we're riding the wave, you know, we're coping. It's not going to be like that. And I think that one NHS commentator described the sort of government's approach as being optimism and complacency being used as a political virility symbol, and actually avoiding having the hard discussions and facing up to the reality. Johnson likes to think that he's some kind of a reflection of Churchill, but in this instance, I mean, he never has been, of course, but in this instance, he's behaved more like Nero, fiddling while Rome burns. And one question is why? And I think they know that they're taking a huge gamble, but the potential reward, they think, is that the economy will somehow do better if you don't have increased restrictions. Now, the evidence for that is very weak. In fact, the evidence suggests that countries like some of the European countries that have actually introduced greater lockdowns, you know, countries that go in hard to try and decrease spread of infection, that their economies actually do better. But I think that's part of their reasoning, and they know that the economy is taking a hit from Brexit, and they're looking at ways they might be able to minimize the impact so they can still present themselves as having done a good job, and that's not going to work out. And I mentioned the need to vaccinate poorer countries. Only 8% of people in lower and middle income countries have had one jab so far. And you've got the international effort through COVAX delivering stuff that's unusable because it's already out of date, or as soon as it gets there, it's out of date before it can be distributed. There has to be a new approach internationally. And that's not just waiving intellectual property rights to production of the vaccine, which of course our government has blocked. It's actually facilitating local production by waiving those property rights, but also helping with building, helping with technology and expert advice so that local production can take place. And what's this being presented as by some like Martin McKee from Independent Sage, writing in the British Medical Journal recently? His call is a vaccine plus approach. What we seem to have, or I think what we do have at the moment, is a vaccine only approach, because that's the government's answer to everything, is to, well, if everyone was vaccinated, it would be okay. I mean, a big problem with that approach is that 5 million people aren't vaccinated. And of course, even if you had 2 vaccinations, they're not very effective against COVID. So you've had to have the booster. Now, if you don't have measures in place to reduce viral transmission, and you're not vaccinating the rest of the world, this is a pattern which is just going to continue. So you have to have interventions that reduce viral transmission and drive cases down. And that's things like mask wearing, working from home, but also very much indoor schools and workplaces, having good ventilation and viral filters in your air conditioning. It's no good just giving schools carbon dioxide monitors, not telling them what they do, and the CO2 reading is high. You have to do something effective about ventilation. All these things have been said for over a year, but they're still not really being implemented. So a vaccine plus approach is, yes, do everything with vaccination, but actually look at the public health interventions, which are all listed by the WHO as being crucial before vaccination. Look at those, implement those, get infection rates down low, and then it actually test and trace, isolate and support has an opportunity to be effective. So that's just what I want to say about the sort of current COVID situation. And the other things which Nick mentioned with the health and care bill, and then just to say a little bit about the People's COVID report very briefly and the SOS NHS campaign. So we have this legislation going through parliaments with the Lords at the moment. You might think it was going to address some of the problems going on in the NHS. So the massive understaffing, 100,000 empty posts before the pandemic, the huge loss in beds that there've been because of the need for infection control, the huge task of catching up with the waiting lists, planning for training more staff because they're needed, not just in the NHS, social care as well. GMB estimate there'll be 170,000 vacant posts, social care. And actually, the bill is not about any of these things at all, but it is about another reorganisation of the NHS into these 42 integrated care systems. And that's my first criticism of it, is it's not actually addressing the burning issues that are going on in the health service. Neither does it address problems with public health, how to make us more resilient in the pandemic and for the next pandemic. It doesn't actually tackle the problems in social care, even though social care is supposed to be included in the bill. It doesn't help address the burning issues of health inequalities, which have been highlighted very much by COVID. A lot of politicians are very keen to say to us, it's not about privatization. I mean, I would disagree with that, of course, but they're not really able to say what it is about. And this is a paper that Caroline Malloy wrote, which you may have read, that they're very, very good at saying, yeah, nothing to do with privatization. Okay, what is it about then? And then it's very vague. But it was sold as getting rid of competition and by implication privatization. It certainly doesn't do that. It repeals Section 75 of the Lansley Act, which is about mandatory tendering, but it actually deregulates the markets in healthcare, removes some of the safeguards in terms of contracting. And actually, in that sense, that's one of the ways it's likely to increase privatization. And of course, we've seen in the pandemic what's happened with contracting, with these massive contracts that have gone to people like Serco for test and trace, 37 billion. It's been a waste of money. You've had this case in the judge reported on today or yesterday, brought by the Good Law Project and Every Doctor, about the VIP lane for PPE, and that has been judged as being illegal, which I think is a great victory for the people against a corrupt and inept government. So the legal finding is it has been legal. The judge then said, yeah, but they would have got the contracts anyway. Well, if that's the case, of course, it just tells you what a terrible situation the government procurement system is in, because for some of those companies, Ianda and one of the other ones, the stuff was unusable. So it shows this huge disregard for the use of taxpayers' money, and of course the safety of NHS staff. I know I mustn't go on for too long, so I'm not going to maybe say all the things I was about the bill, and we can come back to that. But other features of the bill is it shifts much more power towards the Secretary of State, makes the NHS less accountable, means the NHS can step in to dictate what should happen with local reconfigurations. And it does give more power to private companies. And although there's been a very, there's been a kind of gesture in terms of amendments, which sounds like it would keep representatives of private companies off the boards, that's very qualified. And it doesn't say anything about them being on all the committees to which the boards are likely to delegate their powers. So there's plenty of scope for this to increase the influence of private companies within the NHS, no question about that. And a few other problems include the promotion of the digital first health service, which is okay if you're very computer literate and you have an iPhone. I mean, actually, I've been arranging appointments with my GP over my iPhone recently, having to send them pictures. I found it quite difficult. I found it quite difficult. I found I had to take pictures, first of all, pictures that gave them a chance of understanding what was going on, and then finding the file type from my new iPhone wasn't recognized by the surgery and had to convert them into a different form, all those kinds of things. So although there's a role for digital health, it's going to disenfranchise a lot of people. Data sharing is another thing. They want to use NHS patient data to lure private tech companies to come and invest here, and that's going to result in loss of privacy. And then there's lots of threats to the workforce in terms of de-skilling, down-banding, much greater flexibility expected, being told where you're going to work and move around. So a lot of bad things about the bill. I'm sure that's one of the things that we can discuss more, but let me not spend any more time on that. I will say something briefly about funding. The government are always saying, put more money into the NHS than ever before. You know, we're doing a good job, but you have to look at need. And of course, the NHS has had the biggest funding freeze over the last 10 years that it's ever had. It always used to get 4% uplift every year till 2010. Then it was cut to 1%, but rising population, rising demands. And then there's been a bit of extra money put in, but not very much. And there's a huge deficit which needs to be met. The 36 billion recently, you know, you can split that off. 6 billion goes to Scotland, 9 billion goes to the Department of Health and Social Care for training and for the vaccines, cost of the vaccines, and 15.6 in theory goes to social care over 3 years. That's a drop of ocean. When you start to look at what would find its way to the NHS, it's not very much. It's certainly not what it needs to tackle the backlog, to open all the beds that have been closed because of infection control, etc. So it's no good saying that the NHS has had more money than ever before. You have to look at the money it needs. I mean, simply the ongoing costs of dealing with COVID are costing about 5 billion extra a year. And of course, that's not gone away. So that's it on funding. COVID inquiry, Nick asked me about. I think most of you will know about the People's COVID Inquiry. How do we use it? Well, we're trying to promote it and share it as widely as possible. And I think it would be really good if people can draw it to the attention of their local council, their trade union, whatever political groups they're in, ask your library to order copies, that kind of thing. But one of the things that we did was to raise with the Metropolitan Police through a letter to Cressida Dick, saying that we thought the inquiry uncovered clear evidence of criminal activity in the form of an offence which is called misconduct in public office, also possibly under corporate manslaughter, and that this needed to be investigated. Now, we're not naive enough to think that they will come back and say, yes, we agree, we're now launching the investigation, or even if they did, that some of the politicians would end up in the dock. But it's getting as much political mileage out of this inquiry as we can do. It's also, we hope to use it, always hope to use it to put pressure on the official judicial inquiry. And also it's fed into the British Medical Association, who are going to launch their own inquiry from the perspective of staff. I think it's had a lot of value. And some of the chapters, if you haven't read the whole report, I mean, it's still all on the web via the video testimony, but there's some good chapters on the kind of corruption and the crony contracting, and also on the whole governance issues that were raised, and the sort of badly way that the whole thing has been handled by government. So lots of mileage still in the COVID inquiry, I hope. And then finally, you know, what can we do? Well, I think everyone probably is doing what they can to campaign against the bill, whether that's leafleting hospitals or leafleting on your stalls, but also been writing to MPs, now writing to the Lords. It doesn't look very promising, but we have to try. I'm not sure that Labour's heart is in kicking out the bill, which is what we want, even though they've said that's their position. Peter Roderick, Alison Pollitt just come up with a useful document on what amendments have been tabled already that are worth supporting and what others should be put in. And again, we might have time to discuss some of those. And the last thing to say is about this new campaign. There's a website, SOS NHS, you'll find it. And the idea of that was to say, look, the NHS is in real crisis at the moment. One of the things which would be immediately helpful, one of the things is a better funding settlement. So let's have 20 billion now up front. There's lots of things that could be done. This is not as much as the NHS needs, and there's a lot that needs sorting out. But, you know, we've seen U-turns, a budget's coming up in March. Let's put public pressure on politicians saying, let's have 20 billion now. And on the SOS NHS website, you'll see where that figure comes from and where it might be spent. And that's the main demand. It's support NHS staff and look after them, but let's have 20 billion now for urgent work that needs to be done in the NHS to alleviate some of the pressures. And the idea is that it's a very broad-based campaign which brings in campaign groups, civil groups like Pensioners Association, groups like CND, who campaign over nurses, not it's question of priorities, and bringing in the unions. And the big health unions, including Unison, have come along and signed up to this. We have weekly meetings. Their logo is on the website, and they've agreed to inform their members and to build for a national day of action on the 26th of February, which comp groups will be organising, but will be reaching out to anyone else who is interested, and certainly health staff. And I hope we'll have things like an interactive map on the website so people will be able to find out easily what actions are being planned. And then the budgets, I think the 21st of March, so there will be probably another series of actions around that time as well. But 26th of February is an important date. And then before that, on the 19th, which is a week today, there's an online rally with a host of speakers to kick off the SOS NHS campaign. And this is really to try and explain to as many people as possible, including many Tory voters, that their interests are in having a publicly funded NHS that works for them and is there for them, and not something that's privatised and marketised. And we need government commitments to support a publicly funded, properly financed NHS. Okay, I'll finish there. Sorry, it went on a bit long, but let me finish there.
We're on mute, Felicity.
Apologies. Sorry, I've got a comrade on the phone trying to listen on the phone, and we've lost the connection there. Sorry. So, who would like to kick off the discussion or ask questions? Nobody? Nick? Sorry.
Felicity, can I just to thank Jon, not just for the work that you do on a day-to-day basis, but for coming along tonight and talking to us. And I'm just in awe of how anybody in the health service is coping at the moment. I think one of the things that you just said about Labour not having the heart into fighting this bill, I hate to say it, having been a member of the Labour Party for so many years, but I would agree with you, especially following Wes Streeting's statement this week about using private healthcare companies to lower the waiting lists. But having said that, just on a local basis here in Huddersfield and West Yorkshire, I've been involved, and Rob, my husband, is on this call as well, in the local campaign for the Hands Off HRI, and fighting cuts to our local health services. And to a certain extent, that grassroots campaigning has been successful. We did prevent our A&E from closing. So I am feeling negative about the two leading political parties and how much they are actually doing to protect our NHS. But I do have a strong and firm belief that good, effective, organised collective action and grassroots campaigning can deliver success. And so I'm pleased that this new campaign is being launched, and I'm more than happy to support in whatever way I can, in a small way or whatever. But thanks again, Jon, and I'll do whatever I can to support.
Thank you.
I've never known people to be shut up by the extent of the problem before. Well, people are gathering their thoughts.
Len's got his hand up.
Okay, great.
Harry now.
Okay, Len.
Yeah, Len Arthur from Wales, Left Unity. Yeah, again, I'd just like to echo thanks, Jon, for a very clear, concise statement. It obviously reflects your deep understanding of the situation, and you've certainly conveyed that. Thank you very much. I'd just say, in terms of the Welsh situation, I'm very interested in this 26th of February demonstration. You mentioned Scotland earlier about the distribution of NHS funding. Of course, funding comes to Northern Ireland, Scotland and Wales through a formula called the Barnett formula. So that any funding that's allocated to the NHS, a set proportion of that comes to the other nations. And so the funding issue is one which would directly concern Northern Ireland, Scotland and Wales because of that relationship, although the bill and so on doesn't apply in Wales. We've done some work as we're very involved with the People's Assembly in Wales, which is very active, much different to the People's Assembly that people might have heard of elsewhere in the UK. In Wales, we're very, very active and meet very regularly, and we've done consistent work on exposing austerity in Wales. And even with this burst of funding this year, it's more or less caught up with the situation in 2010 in terms of the austerity cuts, but means we've just been treading water since that time. And the budget which is being considered by the Senate, the Welsh Parliament, in February and March, is quite clear that both the chief economist and the finance ministry and all the papers indicate that after this current financial year, 22-23, there will be another round of austerity in real terms cuts. So it's very important that people are not put off the austerity argument by a burst of funds in this year. All the evidence is that that's not going to continue. It's not going into core funding, and so we're certainly. I've made a note which covers most of the active left in Wales, and we'll certainly put the 26th of February down as an issue there. And just a final point. One of the things that we are arguing for in Wales is a comprehensive needs-based review of funding. So it is, in fact, to take the issue you raised, John, of need, but then translating that into a demand of saying that really there's only one way of dealing with a funding issue. That's to ask the service, what does it actually require? And then take the political decision to ensure that money in real terms is provided. So that's that, in a sense, is one of our key demands. So there we are. Thank you.
Thanks very much, Len. Yes, I mean that is a key demand, and of course, it's in a sense it's completely the opposite of what the integrated care system proposals are, because there it's you have a pot of money and you can't have any more, and that will be legally enforceable in the way that local authority budgets are enforceable. The 6 billion I did say for Scotland, actually it is 6 billion for the devolved nations, but it was just an illustration of how 36 billion sounds a lot, but then when you start splitting the bits off that have been promised elsewhere, you don't end up with very much.
Did you just call me, Felicity? You're muted at the moment. I presume you did.
Apologies. Trying to organise people listening.
No, I read your lips. I saw my name being called. So that's all. Okay. Thanks very much for what you've said so far, John. I just wondered what your view is on Rishi Sunak and his trips to California. I understand that he's been spending a lot of time talking to companies in the United States that are interested in taking over services within the NHS. Can you say what your thoughts are on that?
Yes, I mean, I think my thoughts on Richie Sunak is that he's thoroughly untrustworthy, and of course he's moved from saying the NHS can have everything it needs to saying, well, I don't know whether we can afford to pay for these vaccines without it coming out of the current budget, which is pretty dreadful. Have you seen? Do you read Jenny Shepherd's Calderdale NHS blog? She has an article on what Sunak was doing in California, and you're quite right. He was schmoozing tech companies, and I think what they, what they're offering is that access to patient data. That's one of the things that's being offered. I mean, we're so unique in the UK with the National Health Service as having this massive long-term detailed data on the whole population, and it's unique. And tech companies are very, very keen to get their hands on it, and the government's probably very happy to give it away if it thinks it can use it as bait. And this is why they're trying to weaken or get rid of the general data protection regulations and make it much easier to access people's data. So he was up to no good. The data strategy comes in there somewhere, and that's a real concern. But actually, Jenny's article, which is on Calderdale and Kirklees 999 call for the NHS, her blog, which is always very full of detailed analysis, actually has a good article on the background and the companies that he was dealing with and what their interests already are. So I recommend that.
Nick?
Hi, yeah, I just want to say a little bit about schools. It was interesting watching the health minister in Germany talking about what a disgraceful state of affairs it was in Britain, where they're not wearing masks, that they've not got air filtration or purification systems, minimal ventilation, and just saying how dangerous it was potentially. We've missed so many opportunities with this government, and people really should be getting quite angry. When you watch interviews, it's seen as Boris Johnson's a bit of a joker, or he's a bit of a dude sort of thing, when actually it's absolutely disgraceful, criminal actions really of a politician, what they've been doing, what they've put children through, their families, their relatives. When I think of my close relatives who basically had very, very minimal healthcare and are constantly being badgered into looking at private healthcare, to look at appointments that would have routinely been done under the NHS, and to raid what few savings they've got, if any, just so the last few years of life could be a little bit more comfortable and living without pain. And that's something I'm really passionate and angry about, is the amount of money that the NHS has been starved of. And when I see contracts going to the private sector, which could be used for long-term investment in the health service, for staff, for training, for beds, improve morale, ensuring the surgeries met that people have been waiting for, it's absolutely urgent. When I mean, my mum's been on blended food for, it's nearly a year now, and that's it, waiting for some sort of meeting with a professional who can go through what the diagnosis is. But to live like that, have your Christmas meal blended, and then be told, have you considered private? It's absolutely disgraceful what we're living through at the moment. So I hope people are furious and angry, and I hope people look at the SOS campaign. There's little things you can do. I mean, I'm active in Leeds, that's where I know John. We try lots of things. There's been leaflet in hospitals, we do public protests. During the lockdown, we've used banners, which have been done to great effect in Leeds. It's amazing. I got a memory on Facebook saying these banners were in Leeds about the NHS. A year on, they're still there. There's things like in Leeds, we wrote to doctors' surgeries to thank the staff. We do postcards with messages on that we can use. We've tried to do so many things, and we're also aware not everybody can go out and do street protests. So we're really keen on people doing things in the locality, whether it's writing to people, encouraging others to get involved. Emails do matter. Letters to the newspapers do get printed. These things are really important. So this new campaign, the SOS NHS campaign, it's really good. It's basically saying it's 20 billion now, but instant cash injection, not giving it to the private sector, which can be passed on to shareholders, long-term investment now, looking after staff now, and it's got a lot of really good people on board. So I think it's a real opportunity from people, when you do leave the meeting, look up the campaign, but also think about what we could do in the local areas, because it really does upset me when I look at my generation and my parents' generation, what they went through, who did grow up in the 30s, who remember the NHS appearing, and then in the latter days when they're older and they are needing it a little bit more, how little's there for them and what they're going through. I mean, my brother's an ambulance driver. He turned up for work in Sheffield. He was the only person on the shift. People were isolating, people were down ill, loads of ambulances off the road. I really think it's something we hear a lot about the NHS. We watch a lot of it on the news, but I think people should be absolutely furious now, really angry, and want to go out and try and make a difference. And I can assure you, people going out does make a difference. If people don't know about the union campaign, tell people, if we're getting Unison, Unite, GMB and other campaigners, it's a golden opportunity to write to your trade union members and encourage them to do things, because I really do think we're in a terrible position where so many staff are resigning, so many staff are ill, so many staff are exhausted, and then we've got the 5-6 million people on waiting lists. You know, we've got to do something about this government, and I honestly think the 26th of February is a fantastic opportunity. And if people are united, we've got big unions, good campaigns, we do have a good chance of making a difference. So just really urging people, you know, it's thanks so much to John, but I do think there's a lot more we could do. Okay.
Thank you. So
Yeah,
I don't have anyone else asking a question. Is that no? Okay, I'm going to abuse my position in the chair then. First of all, I'm trying to say every meeting about the NHS mention maternity. What's going on in the maternity service at the moment is both appalling, and given that the midwives are organising, really, really important. You know, marching with midwives, if you want to look it up, it's not entirely everything we'd want, but it's great that they're organising. And we had little events right across the country a few weeks ago, organised by the midwives themselves. So we're desperately short of staff. The midwives are leaving because they cannot stand working in an unsafe position. And whole wards are being run on agency staff. And agency staff are not as good. They might be individually brilliant. They might have very good reasons for working agency, but they don't know the town. They don't know the area. We've got to be arguing for a fully funded maternity service with much better respect for the people working there. And of course, it's the mothers and the babies and the families who experience the lack of care and the damage that that's done. By having that poor care in maternity. So please, you know, when you're talking maternity, when you're talking NHS, mention maternity. As Thelma said about Hare Local Hospital, our campaign to save Liverpool Women's Hospital has succeeded. We know it's day by day, year by year, we have to keep the campaign going because the pressure is on. More maternity units are being closed than anything apart from A&Es. So we've got to look really seriously at the issues of maternity, but the hospital is there because of the extent of the campaign and the scale of the campaign. So don't think you can't do anything. You can. The other thing I wanted particularly John to hear this, that we attend the board meetings regularly of the Women's Hospital, go through their paperwork and all the rest of it. There is a problem because the ICS organisations expected to be up and running by April. They have a system going, and that system allocates the money to the hospitals for the start of April 22. They don't have established budgets yet because the ICSs don't know what to do because they're not legally established. They reported at that board meeting that there was going to be a meeting of all of the chiefs of the trusts with the ICS to say they are not prepared to accept harsh cash limits where they're told simply they'll just have to make do with the budget that's given, negotiated or not negotiated. So there is chaos in the making of budgets in the hospitals. And that must be true of those other than hospital trusts, those in the community and the primary care as well. So without going through the law, they've set up the ICS systems. And the ICS systems can't go further because they're not now, when the legislation's not going to go through in time. So we're going to have real problems with the money in the hospitals. And hopefully, you know, other hospitals will be as forceful as the Women's is being in saying they're not prepared to accept sort of random budgets. They have to have quote Len, a needs-based budget. But that crisis is there. And as the ICSs are implemented, if we don't stop this bill, there will be 42 different sets of crises. We listen here to the complexities of what Jon's told us about, but what's happening in Cheshire and Merseyside will not be the same as what's happening in Lancashire and South Cumbria, will not be the same as what's happening in Yorkshire, will not be the same as what's happening in London. Each of the 42 areas will have their own budgets, their own priorities, their own capacity to enforce cuts. And the greater the level of involvement of the people in the area, the harder they will find it to implement cuts. But in some areas, there just isn't the organisation yet. So when we come to the SOS campaign, they can't ignore what's going on with the ICSs. They can't ignore the bill. And they have to take into account the fact that in some areas, there's absolute urgency to set up organisations which will hold the ICSs to account. Now, it's going to be hard. You know, sheer physical geographical scale of our ICS, right the way from Sefton right down to south of Crewe, it's hours in terms of driving. So it's not going to be easy to hold them to account, but we've got to do that. And it's crucial that we cause as much trouble as we can to this bill in getting through, and to delegitimise it, so that even if it technically goes through Parliament, it has no moral weight. And this thing they've got of rationing care, saving money by rationing care, pushing people into paying, or like the issue of the cervical screening, making a 3-year gap, that sort of stuff has got to stop. We've got to have campaigns, and only campaigns will do it. I mean, Left Unity is not a huge political party, would that it were, but we've got to use our people in the areas where there's no major campaign to get that started, or people will be in absolute, they'll be up the wall about not being able to get their treatment. A woman stood and talked to me, very sensible, clearly spoken woman stood and spoke to me about her 27-year-old son, who she said she had no hope at all of stopping him committing suicide. She knew it was just when it happened, not if it happened, because he could get no help at all. If they went to the hospital, they were just sent away. And that's the scale that we're talking in. And that will be not just in mental health, which has deteriorated terribly, not just in maternity, that will be across the board. And we've really got to build the defence of the NHS in the areas. And I'm sure you agree with that, but my fear, Jon, is SOS, without mentioning the bill, without mentioning the ICSs, will not be enough to actually either protect the staff or to tell people what's needed in their areas. That's my rant, Jon.
Okay, well, I don't disagree with any of it. In terms of the SOS campaign, I think it has to go beyond the budget, you know, so it has to go beyond this sort of single demand. So I think the idea is let's have a very simple, straightforward demand that potentially is achievable in terms of a cash down payment. But I think what I would hope for is that we're going to forge a much better alliance of campaigners, patients, civil organisations, what have you, unions, to carry on the fight for the NHS, so that there'll be something that goes beyond, you know, it won't, SOS NHS won't be over in March if the money isn't coming from the budget. And a lot of it, of course, relates to the bill in the sense that calling for the proper pay and conditions of staff and more funding goes against the direction of travel of the bill. But I know what you mean. The bill is not a prominent issue within the SOS NHS campaign, but I think that I hope that campaign is going to build a structure that will carry on into much more general campaigning. And meanwhile, of course, everyone is still working to do what they can to oppose the bill and encourage the Lords to either reject it or certainly put in some amendments. I mean, I think you're absolutely right to, of course, to emphasise the huge problems in maternity services. We had a good demonstration in Leeds, about 150 people with March Midwives, and we have approached March for Midwives to provide a speaker and also to be a supporting organisation for the SOS NHS. I mean, just sorry, other couple of things that just came up when Nick was speaking was the problem with ambulances, and the College of Emergency Medicine estimated that 4,500 people died last year because of the situation with ambulances not being able to react in a timely manner and then get their patients out of the ambulance into the hospital. You know, huge figure. And the burden on staff is taking its toll. I think I read yesterday that in the fourth quarter of last year, 37,000 staff left. Now, staff leave all the time, of course, but that's twice what you'd normally expect. So very difficult retaining people.
Yeah.
And then on midwifery, my nephew's wife, I never quite know how you describe your nephew's wife, but went into Lewisham Hospital to have her second baby 2 days ago. She's had cardiac rhythm problems throughout the pregnancy and was on treatment. No midwife throughout the delivery. They managed to find a nurse, but no midwife. I mean, things went well. The baby's home, but you know that was a bit shocking, I thought. So always very important for maternity to be flagged up.
Thank you, John. That shocks me. Dave Landau, and I think we'll make Dave the last speaker because people are leaving because we're going on for quite a while. Dave.
Okay, I'll try and be short. It won't be a rousing last speaker speech. Yeah, I wanted to raise, I'm from Left Unity, North London, but also involved in Patients Not Passports and Docs Not Cops and Solidarity Knows No Borders, who are campaigning to say, quite rightly, that a free health service is free to all, and all doesn't mean that you take on immigration status. And I think that's important at this time to raise, because one of the things our enemies will be taking up sometimes and trying to divide and rule and saying, well, you know, these people, they may be saying there's not enough resources, but look, they support that money going to migrants and things like that. So I think it's very important to make sure that that people are aware of that and keep and fight for those principles and involve organisations like People Not Passports and Docs Not Cops in this SOS campaign. And so that I was just going to raise. Thank you.
Thank you very much, Dave. And of course, the women who are denied maternity care on that basis are, you know, we know at least 3 of them have died because of that. So yeah, the very, very important situation. So John, would you like to sum up in just a few minutes?
Well, very briefly, I mean, just coming back to what Dave said, migrants organise are a supporter of the SOS NHS campaign, and their logos on the website. And of course, the ICSs are posing an increased threat to people who don't have a settled status because of the focus on a kind of core responsibility for people who are signed up with general practices in the area, with a potential that other people are excluded. So there's an implicit threat, unquestionably, to make things even more difficult for migrants and refugees. So to sum up, the whole pandemic has been very badly mismanaged, and that's was the focus of the People's COVID inquiry. It is well worth reading. It's available online through the inquiry site. You can actually now buy a copy of the executive summary, which is quite a good chunk of it, from the Comp website, if anyone wants a paper copy. But certainly it's available electronically, and all the videos still available. We still need to have a pandemic strategy led by independent expert public health doctors. You know, we shouldn't have politicians like Nadim Zahawi saying how the management of the pandemic is going to be done, and the talking about reducing period of isolation to 5 days for people, this kind of thing. You know, it has to come from expert public health doctors. And I am signed up to this vaccine plus approach, which is only what a lot of campaigners have been saying for a long time. Anyone who's involved with zero COVID, for example, it's about there has to be a whole raft of interventions to keep the infection under control, public health interventions, and vaccination is only one of them. And for goodness sake, what are the government doing now? Selling off the vaccine innovation centre in Oxford, when that was set up with public money and was hailed as being a key part in our defence against future pandemics, now being put up for sale. So we should all be complaining about and protesting about that as well. It is difficult sustaining campaigning, and it absolutely has to be done at a local level, and that's really important. And it's been great to work with Nick over a dozen years in York, in Leeds, on campaigning here, and we also do have a network in Yorkshire where our York colleagues come in as well. But the local grassroots campaigning, as Thelma highlighted, is absolutely crucial in what we're all about. But there are, there is scope for this sort of national coordination and trying to enthuse people. Part of the SOS campaign is about trying to enthuse people, saying, look, the government have made a number of significant U-turns. This is another possible U-turn that we might be able to force on them. But it is in a sense, a kind of single issue campaign asking for this, but it would be crazy if that money doesn't materialize, or does materialize, that somehow that's the end of that alliance, and it has to be used to build into an even broader national campaign in defense of the NHS. So have a look at the website, and badger your trade union branches. My trade union branch is almost 1,000 health service members. We get about 6 to meetings. They're not terribly good at supporting events defending the NHS in Leeds, but now I've said to them, look, this is actually being supported by Unite nationally. That means there's an expectation that branches will do something. So come and support events on the 26th of February. And thank you for inviting me to speak, and for the comments and contributions to the discussion.
Thank you very much, John. I hope your great nephew or great niece is very well and survives the lack of proper treatment. But thank you to everyone for coming. We will continue through Left Unity and wherever we are to push the issue of fighting for the NHS. We are entitled to good healthcare, and this country can well afford it. We're not going to let them get away with it. So Thank you very much for coming, everybody. A recording of the meeting will be up probably day after tomorrow because my tech isn't all that good. I'll see what we can sort out. But thank you very much and keep fighting for the NHS, folks. And we'll make sure that we put the 26th as a major point in our propaganda. Thank you, everybody.
Solidarity, comrades.
Solidarity.
Everybody, keep safe.
Bye bye now.
Yeah,
Bye.
keep safe.